Oh, snaps!
The world is finally waking up to the crap that's baked into and sprayed on kibble dog food. No longer can commercial pet food manufacturers fool us with pretty pictures and false promises. This is the raw dog food truth. The view and opinions expressed on this podcast are not intended to replace medical advice. Before starting any raw diet, do research, ask lots of questions, and consult your vet.
Your vet, and go in when you're not with your sick pet, because when you're emotional, you're not thinking clearly. None of us do. It's a physiological response. Your body's in fight or flight. You're not thinking clearly. You're not thinking logically. So make that appointment, pay for an office visit, go in, talk to your vet, say, present some of this information you're going to be hearing tonight, and ask them, why are you requiring rabies? Like, what right do you have to do this? And there's going to be a lot of information tonight, things that you can say, just quotes from the AVMA sites, some pretty good, I think, concrete tools that you can use to go in and talk to your vet. But when you go in and your pet's sick or hurt and you're in that emotional state because you're worried, you're like, that's where people get stuck, because I could just give them the shot because I just want you to treat my pet. Because you're so worried. You don't want to have to go run to 5 other clinics to find somebody that won't require a rabies shot. You're like, well, hopefully I can just deal with that later. Establish it ahead of time and have an established relationship with a vet that is in alignment with how you want your pet treated. They work for you,
Well,
they have no
does
right
it
to
seem
bully
that
you.
way? Doesn't seem that way, does it, Dr. Jasek?
Does not seem that way because they become bullies.
Right.
They really become. I was telling Didi, I did a video call with a lady in Saudi Arabia today. I have to put that up on my map.
Right. You have to need a pin of behind you of all the places that you're
right,
zooming with people.
Right. Talked and same thing there. Very nice lady, feeds raw, really tries not to vaccinate, but she's like, she went in, her dog had a seizure, and the vet told her dog had a seizure because it did not have a rabies shot. That doesn't even make any sense, right? But this is the backwards logic that they are. Somebody used to live in Saudi Arabia. This is the backwards logic that they're using. And she said, between the fact that I'm not vaccinating and I'm feeding raw, like they just kind of write me off because I'm just killing my pet, And it's the same thing here. It's interesting to me how this narrative is all over the world. Literally, it's certainly all over the United States, but it's definitely worldwide.
Yeah, it is. It is nuts. It is nuts. So we hope that you're going to enjoy tonight. I will say this. I think it's going to make you a little uncomfortable. All right. And I mean it like this, because you are going to have to take the action. Okay. I can't take it for you. Dr. Jasek can't take it for you. So if something makes you uncomfortable, don't check out. Okay. Try to hang in there. It's sort of like when I do, my 75 hard program and I'm having to do my stretches. Right. And she's like, breathe through it. I know you want to let the stretch go because it hurts.
Hi, Deanna.
But you got to keep going. All right. Before we start, Dr. Jasek, I have a little poll. I want to throw out there for the gang. So these questions are anonymous. I don't see who you are. Nobody knows who you are, but there's 3 questions on here, guys, and I'm going to launch that right now. So what we want to ask you to answer is, we want to know what kind of protocol you're currently following. Are you doing an every 3-year rabies vaccination and every year? Are you a one and done or no rabies ever? Remember, these are anonymous. We do not see who you are answering these questions. So we just kind of want to get a feel for the room tonight and see where we are. Okay.
And we won't be reporting this to the rabies police either.
Who are they? That's what we're going to answer. We're going to answer that.
That's it. They're the mysterious police force that supposedly exists. Yes.
Right. The boogeyman. This is very good though, Dr. Jasek. I'm seeing a very low every year schedule. The one and done is pretty good. Every 3 years, kind of with the one and done. All right, all right. I see not everyone participated, but this is good. It's gearing back up. It's gearing back up. Let's see where we are. 40% of so far, 41% of the room is saying one and done on a rabies vaccine. We've got 29% that are on the every 3 years rabies schedule. A very low percentage, thank goodness, are doing the every year. 26% going in at the no rabies ever. Okay. So, the second question that you might be answering is, my fear level that my dog will get rabies is either very high, moderate, or never a thought in my head. Would you look at that, Dr. Jasek? 77% of this group tonight says never a thought in their head that their dogs are going to get rabies. Isn't
Oh,
that
very,
awesome?
very interesting.
That's awesome. So we don't have a big group of scaredy cats out there.
We're not
And
afraid of the
nothing,
disease.
no offense to whoever answered that.
It's just trying to, they're just trying to work the system. And I
Right.
get it. There's things that are very hard to do without a current rabies shot. And that's why we're going to need to learn to do some pushback.
Right. Okay, the next question that I had is why I'm attending this webinar is because I need more information to push back. That's very high tonight, Dr. Jasek. That's why a lot of these folks are here. The second group is I want to confirm my rights as a pet parent. And then the third group is, well, actually, it's a multi-choice on that one. Pet parents want to know that they're not alone. I was going to put just because I like you, Dr. Jasek and Dee, but I decided not to put that in there.
Okay. We might walk away with hurt feelings. Nobody likes it.
Right. They were like, no, I don't really
Nobody
like you.
likes
I don't really like you. Which is fine. All right. So that's some great information. We so appreciate you guys participating in the poll. And now we know, Dr. Jasek, what our marching orders are tonight. So I'm going to turn it over to you. Again, guys, we will have an audio for you after this, and then it won't be tonight. Okay, it'll be tomorrow.
Oh, come on, Dee. Stay up till the wee hours doing the audio.
And probably because I'm drinking coffee and not smart at 6:44. Okay,
man, I'd be up half the night.
Right. All right, Dr. Jasek, take it away.
Okay. Are we recording? Did you hit record?
Yes, I hit record. Thank you, Neely.
Okay. we're all making sure. Okay.
Yeah.
So let's see.
And while Dr. Jasek is bringing that up, I just want to remind you guys to tell your friends about the Raw Dog Food Truth podcast. It is on 4 days a week, Monday through Thursday. We answer a lot of questions. And you can always write us and email us at info@rawdogfoodandco.com, and we'll be glad to answer your questions right there on the podcast. All right, take it away.
Okay. You see my screen okay? Can you see my screen, Dee?
Yes, ma'am. I got you.
Okay. All right. Good. Okay. Welcome, friends. Hopefully this is good information on the subject of rabies. Okay. I am Judy Jasek, DVM. That's my website, ahavet.com. I am currently doing telemedicine only, but happy to help you out if you want to reach out and schedule an appointment. I graduated from Colorado State University in 1988, so I'm old. I've been doing this for a minute and been practicing primarily holistic veterinary care for about 25 years. I started out indoctrinated like everybody else does, but, saw the light and started moving in a different direction. And my foundational belief is that health is the natural state of the body and that there is an innate ability to heal, and the focus of my practice is supporting that. So I have been wondering for years where the whole rabies narrative began, because there's this intense fear around this rabies virus. So is that really founded or is it fictional? Because we've been finding, especially in recent years, that a lot of what we've been taught in medicine is not true. Are the mandates imposed by local authorities and veterinary clinics really justified? And I kept wishing that somebody would do a deep dive and provide more information. And then I realized, I guess that was going to be me. So here's what I found out. Okay, so there is an increasing and distressing trend in veterinary medicine that requires pets to have current rabies vaccine before they can receive medical care. And I'm sure a lot of you here have run into that, if not all of you. And it's the case in nearly 100% of the veterinary clinics in the United States. Almost all of the clients I talk to around the country and even in other parts of the world tell me the same thing. This is actually in direct opposition to the recommendations of the American Veterinary Medical Association, or the AVMA. The AVMA is the national organization for veterinarians, where they actually set guidelines. So the fact that what is going on in veterinary clinics is counter to what the AVMA is recommending, and we'll go into more detail on this, is huge, because vets will get their policy right. AVMA sends out emails in their journals. They make recommendations for different issues in the veterinary profession. It goes against statements for the CDC and actually many state veterinary boards. So these organizations that are normally veterinarians would go to get guidance are telling a different story. So why are the vets following a narrative that is independent of these guidelines? I mean, that's a very interesting question. Why are they requiring a toxin before even evaluating the pet's health status? This actually goes against even the vaccine manufacturers, as I'll show you later in the presentation. So how does this all get started? Like, if this narrative is going against the recommendations of these organizations that the vets would normally go to, and even the vaccine manufacturers, how does stuff like this get started? And most importantly, how do we restore a more reasonable standard of care for our pets? So a word on local ordinances. So there are rabies laws, city, county, state, depending on where you live. I'd suggest you look those up and find out what those are. This presentation is not saying that you can't, should not follow those laws, but that should be your choice. The purpose of this presentation is to push back and give you information to push back on the mandates that are keeping you from going in to the vet clinics. The veterinarian does not have any right to enforce the rabies vaccine. If you have ordinances where you live and you don't follow those, yes, there may be consequences should your dog bite somebody. However, sometimes there's a need to change laws. How did laws change, in the civil rights era? People like Rosa Parks didn't sit in the back of the bus. She sat in the front of the bus. If you don't know who Rosa Parks is, then you can look her up. But sometimes going against the law and pushing back on the laws is how they change. If nobody ever speaks up, they're not going to change. So maybe you could go to your authorities, go to a city council meeting, meet with your county commissioners and say, hey, would you guys accept titer tests? Educate them a little bit. If you never say nothing and you just say, well, it's the law, so I have to, well, nothing's ever going to change. If you can't just sit back and complain about the way things are, if you don't take some steps to make them different.
And the other thing too, Dr. Jasek, that I think we talk about a lot on the podcast is, of course, there are local rabies ordinances and laws, but don't put your pet in those situations, right? So there are things that you can do. If you want to know about those, go listen to our podcast. We talk about it all the time. All right. Just wanted to jump out there, say that.
Right. You got to keep your pet safe. Don't have your pet running at large, and make sure your pet's well trained so it doesn't, not likely to bite people, that sort of thing, if you're going to choose not to follow the ordinances. Okay, so my objectives tonight are to invalidate the current rabies mandates in veterinary clinics, provide evidence that there are no rules, ordinances, or recommendations that deem the veterinarian responsible for the vaccination status of their patients. It is just, there's nothing written anywhere that that has appointed veterinarians as the vaccine police, and that's what we're going to establish here tonight. Established that vaccination should be the responsibility of the pet parent, not the veterinarian. It should be your choice. The role of the veterinarian is to provide you informed consent, give you the pros and cons of the vaccines, explain the risks to your pet, and then respect your choice. Demonstrate that veterinarians are not instructed to provide, that veterinarians are instructed to provide informed consent, not vaccine mandates. This is actually written in some state practice codes that I'll present later, that veterinarians are actually told that they should be sitting down with the client, providing informed consent. But they're not doing that. Again, they're not following the rules. And of course, to free pets from the discriminatory mandates that restrict care to only the vaccinated. Gee, where did we hear that recently? Doesn't that sound familiar? In the human world? Okay, premise. It is nowhere written that the role of the veterinarian includes vaccine enforcement. They're not the police. They're working for you. You're paying them. They should be following your wishes. Their job is only to give you recommendations. Following local ordinances is the responsibility of the pet parent, not the veterinarian. Veterinarians seem to think that it's their role to enforce this, and it's not. And there are no legal ramifications to the veterinarian for treating an unvaccinated pet. I hear this from pet parents a lot. The vets will tell them it is illegal for them to let them in the clinic if they're not, if the pets are not vaccinated for rabies. It's illegal for them to treat them. And it is completely untrue. There is no such law anywhere. Vaccinating pets without full medical evaluation is in conflict with the AVMA, many state veterinary boards, and even the vaccine manufacturers. So even the vaccine manufacturers, as we'll show later, say in their the package inserts that vaccines should only be given to healthy pets. So the veterinarians are going against these recommendations, and therefore, in my opinion, should be considered malpractice. Okay, so how did this whole business begin? These really stringent mandates, I was not seeing these pre-COVID. Something really seemed to shift in the profession when we had these awful curbside drop-offs, which I'm sure were horrific for a lot of you guys, where the pets were, you handed off your pet in the parking lot and the tech took them in, and you sat in your car and talked to the doctor on the phone, and oftentimes sat in your car for 4 or 5 hours wondering what on earth was going on in there. Somehow it instilled this air of authoritarianism in the veterinary profession, that now, they get to make more rules, and now they're the, big bosses, so to speak. And while it might be difficult to define exactly where this began, one thing is certain, and that is that information is often accepted as truth simply by repeating a narrative often enough that becomes standardized. If the same thing is said over and over and over and over and over again, you hear this in the news. You've ever seen these little video clips where they've got a little frame for 30 different news stations, and they're all saying the same thing? Well, if that many people in a authority position, or that people respect as authority presenting the news, are saying the same thing, people tend to believe it, whether it's true or not. Okay, so let's get into some actual facts and what I was able to learn about how did this start? All narratives start somewhere. So this first piece of information is coming from the book Béchamp or Pasteur by Ethel D. Hume. Béchamp was a contemporary of Pasteur. He was more in the terrain theory camp, where we have a healthy terrain, we're not likely to get disease and symptoms. Pasteur was more in the germ theory, where you have some infectious organism that causes disease, and we know which narrative became more popular. But we'll talk about how this got started. So the rabies narrative began by identifying what were called mad dogs. So this is the classic rabies dogs that you see pictures of, foaming at the mouth, acting aggressive. And I posed the question, is there anything besides the so-called rabies virus that could cause such symptoms? How about poor nutrition, chemical toxicity, chemical burns in the mouth, dogs that are not fed well, that are starved, are eating things, might be caustic, irritating the mouth, physical and emotional abuse. Animals that are abused will become aggressive. So there are most definitely things besides some obscure virus that could cause these same symptoms. These mad dogs are often put to death and never given the opportunity to recover with better care. So it was just assumed they had some terrible virus, they're put to death, and we would never know if they were put on a, better nutrition, treated more kindly, if they would respond and recover. We don't have that data set. So Pasteur, rather than looking at other potential causes of these mad dog symptoms, operated under the assumption that there was a germ that was causing the malady. Other potential causes were never investigated. There is no explanation as to why there are multiple reports of more than one person being bitten by the same mad dog, but not all victims had symptoms of rabies. And as we'll show later, actually very few ever got sick from the dog bite outside of the obvious physical injury. But there's reports of thousands and thousands of bites and very few symptoms of the actual rabies virus, the neurologic type symptoms. So Pasteur, because he was sure that there had to be some virus causing this, developed a test. So to test for rabies. And what his initial test was, he would take the saliva or blood from an affected dog, so the mad dog, and he injected it into the brain of a rabbit. The rabbit became paralyzed, then the dog was said to have rabies. Well, you could inject anything into anybody's brain, you're going to have symptoms. You can inject saline, just builds up pressure in the brain, and you're going to have problems. If you're putting some foreign substance from another animal, well, of course, you're going to have neurologic symptoms. So this really proves nothing. But this was how he established that a particular mad dog had rabies. So when he then went on to develop a rabies treatment, he would take the spinal cord from these test rabbits, pulverize it, inject it into the bite victims. And then, lo and behold, some of these patients, many of them actually, developed neurologic symptoms, paralysis, and death. And the death rate was, in fact, much higher in the treated than the untreated. Like, go figure. Again, we're injecting these foreign substances into the body. Of course, they're going to cause illness. Of course, the symptoms that developed were not attributed to the treatment. They were attributed to the rabies. So these people that were bitten by a supposed mad dog, they're treated with a treatment that causes these symptoms, and it was attributed to rabies. Again, another very familiar narrative, isn't it? Okay. Numerous cases in which untreated patients bitten by the same dog did not develop any neurologic symptoms. So people that bitten by the same dog, some treated, untreated, only the treated ones actually developed symptoms of rabies. Pasteur also found that he manipulated some of his treatment data. And he did this by ruling that all deaths, in the data reported deaths, should be excluded that occurred during the treatment or within 15 days of the last injection. So this is a pretty big time period, all the way during the treatment time up to 15 days afterwards. Anybody that died in that time frame was not counted as a death related to the treatment. So, for example, Casale Institute alleged that in 1910 there were 26 deaths from hydrophobia. That's another name for rabies, is what they used to call it. 14 died during treatment and 8 within 15 days. So that's 22 of the 26 that were not counted because of this data manipulation. Only 4 died longer than 15 days. So it was said that only 4 died as a consequence of the treatment. So be really careful about what you believe. Scrutinize all data that you read, because even today, there's a lot of falsified data. So in summary here, the premise of rabies was established really without any positive identification of a virus, only these obscure outward signs that have other plausible explanations. More data on deaths attributed to rabies, and this is also from Ethel Hume's book. In Zurich, 233 persons bitten by supposed mad dogs. So these are the dogs with the classic rabies symptoms. 4 died, 2 of which had wounds that couldn't be properly treated. So they died from consequences of their injuries. So 1.7%. Rabies epidemic in Stockholm, 106 bite victims, and only 1 developed symptoms of rabies, 1%. And that could be something else, any neurologic symptom could have been attributed to rabies. So if somebody has a seizure or stroke or something like that, said, well, it must be rabies because it's a neurologic symptom. So it doesn't mean that they even had rabies. In France, prior to Pasteur's treatments, there were 30 deaths per year caused by rabies. After his treatments began, this rose to 45 per year. So direct evidence, again, that his treatments were making people sicker than the supposed rabies virus. Okay, this is another paper written by Millicent Morden, and she reports Dr. Matthew Woods, a leading member at the Philadelphia Medical Society. He stated that at the Philadelphia Dog Pound, there's an average of more than 6,000 vagrant dogs taken annually. Catchers and keepers are frequently bitten when handling them. Not one case of hydrophobia has occurred during the entire history of 25 years, in which time 150,000 dogs have been handled. So 150,000 dogs, people being bit regularly, and no reported cases of rabies. So yeah, do we really have a lot to be afraid of here? Okay, so what does the CDC say? So CDC, Center for Disease Control, is a very well-known 3-letter agency that is supposed to give us accurate information on disease risk, disease information. So the CDC on their website, they have very detailed information on the morphology of the rabies virus, what it looks like, how it acts in the body, like all this stuff about the rabies. But there's not a single actual scientific reference. There's just a lot of really cool pictures. So how do we know even where this information is coming from? So we'll see a lot of pictures like this, pretty pictures of the virus, what it supposedly looks like, but where did this information come from? Here's an actual photo of these little bullet-shaped things that are supposed to be the rabies virus. Again, we don't know. We have no idea. This could be a picture of anything, could be made up. They have lots of data on the exact dimensions of the virus. There's a cross-section of the virus and its little organelles and all this stuff. But that's just artwork. Somebody just drew that picture. Again, how do we know this is even true? They have detailed reports on what the virus does in the body. And this is how the virus infects cells and how it travels through the body. So they have this all worked out. But how do they know something like this? I mean, they don't have little cameras going in and following the virus through the body and in and out of all the cells. I mean, if you ask, where does this information really come from? How could somebody actually even know this? I mean, maybe in a cell culture, they could look at some of these things, but that's outside the body. That's not even real life. There's no way they could follow this process through an actual living organism. How do we know it's legitimate? It's a really important question to ask. CDC is not a research organization. It's a reporting agency. It simply collects data. And so when they have information that's not referenced, you really have to ask, is it legitimate? Any scientific article will always have a lot of references. And we're instructed to practice evidence-based medicine. I wish I had a dime for every time I've heard that in my years of practice. So it's not evidence-based, there's no evidence. But where's the evidence here? So how then do we know the rabies virus even exists? I mean, consider that for a minute. If this rabies virus did not exist, if this was, say, all made up, pretty pictures drawn on the CDC website, that would really change a lot of things, wouldn't it? All this stuff about rabies vaccines would go away. And unfortunately, a lot of medicine, much of medicine, is based on the fact that any disease symptom is due to a foreign invader, such as a virus or bacteria. Other causes are simply not addressed. So do viruses exist? Well, a few years ago, I began following Dr. Tom Cowan's work in virology, and we're not going to get into this in detail in this presentation, but I would encourage you to stretch your minds if you haven't followed any of his work and consider it, because I'll tell you, this stuff really, it really blew my mind. I mean, first time I heard it, I'm like, what do you mean viruses don't exist? And for me, this was just like 4 or 5 years ago. It wasn't all that long ago. Like, how could viruses not exist? You know, we've been taught for, you know, all our lives that viruses exist. That's how we get sick. He presents some very good evidence. He wrote a book called The Contagion Myth that I'd highly recommend. And as Dee Dee said at the beginning, we're going to be giving you some other video links where you can follow some of his work and dive a bit deeper into this. Because I think when you really consider what he's saying, it kind of makes a lot of sense and explains a lot of why we are where we're at in medicine, and why things like these recommendations that we're going up against just don't make a lot of sense. So in short, Dr. Cowan, he proposes that there's never been a true virus isolation. What is typically done is you take an exudate from a sick person or animal, so like snot or something from the nose, diarrhea from a dog with woolly paro or something like that. It's processed by adding antibiotics to prevent bacterial contamination and a culture to supposedly grow it. And then they take this toxic soup and look at it under a microscope, and they find some object in there, and they point to it and say, look, there's the virus. It really proves nothing. The way to truly prove that that's a virus, and the stuff that's never been done, is they would do another isolation where that thing they're pointing at is taken out and it's identified all by itself with nothing else in there. And then it's demonstrated that that organism or whatever it is can make another animal or person sick. That would be how you would definitively prove that viruses exist. And according to Dr. Cowan's data, this has never, ever been done. Never. Hard to believe, right? Because we believe that viruses exist. I mean, that's what we've been told. I don't believe that anymore. I think this has been a really, really big scam, and it's made a lot of vaccine manufacturers a lot of money. And whether you buy into that or not, or believe it or not, I would just encourage you to look at the information and open your mind and consider a new way of looking at things, because it'll change how you look at medicine, in particular vaccinations. I think we've been duped into a lot of things over the years due to agendas, profit-driven agendas for the most part. Okay, so if it's not a virus, what causes symptoms? What makes us sick, right? So could the cause, so we say, okay, you know, I went to my family reunion and everybody was coughing and sneezing, and I came home and I got the same cold, so there must have been a virus. Well, maybe there's other things. Maybe there was a common exposure to a toxin. There was something in the air, or there could be a nutritional deficiency. Maybe in a particular family, the way they eat, they are missing certain vital nutrients that could explain certain symptoms. A good example is the case of scurvy. Sailors that were out to sea for months were found to get certain symptoms that went away when they were fed citrus fruits. They had scurvy, which is a vitamin C deficiency. And if you looked at these sailors, they all had the same symptoms, confined on a boat. Well, they must have some virus going through them, right? Because they all got the same thing going on. No, it's a common nutrient deficiency. So I think we need to really expand the way we think about what causes symptoms. And I bring this up because this really, really would change how we look at health if viruses didn't exist, or just if we even consider the fact that viruses might not exist. At least then we branch out and say, well, what else could be causing this? Because if you just write off symptoms to a virus or some other microorganism, we might be missing other causes, other nutrient deficiencies, other toxicities that are not being addressed because we're just attributing them to some infectious organism, which leads to, all the vaccines, which make pets and people even more toxic. So if this were true, it'd be great for our pets, not so great for the vaccine industry. Okay, so let's get back to rabies. So if the rabies is not a virus, then what would be causing these symptoms? Foaming at the mouth and aggression. So here's the list of rabies symptoms from the CDC website. General sickness. Well, what is that? Anything. Problems swallowing, excessive drooling, overly aggressive, biting imaginary objects, tamer than you would expect, having trouble moving or paralysis, a bat that is on the ground. So that's a sign. That one makes me laugh. Well, I've seen all these symptoms many times in my practice. I've never seen one case of rabies. So I can guarantee you that all of these symptoms could definitely be attributed to other things, injuries, poor treatment, poor nutrition. There's all kinds of things that could cause these symptoms. They're very, very vague. So there's really nothing diagnostic in any of these symptoms. And so could this mad dog syndrome actually have been caused by malnutrition and toxicity and not by virus? Okay, so what about the testing? They say that that animals are tested for rabies, and animals, there's tests. So pet gets tested for rabies, they have rabies. Person could get tested for rabies, they have rabies. So if rabies doesn't exist, how are these tests being done and what are they actually showing? So, and it's important to really define this because in pets have to be euthanized to be tested for rabies, because in pets, the only valid test is actually testing the brain, which you cannot do on a live animal. So they have to be euthanized. So this whole assumption of a rabies virus causes a great deal of harm when it comes to the testing, because the pets are of it. So it's really important then that we legitimize the existence of the supposed virus and the potential harm. If rabies is not as serious as we've been led to believe, then we certainly should not be killing these poor pets just to test them for it. So according to the CDC, for animal testing, the test must include tissue from at least 2 locations in the brain, preferably brainstem and cerebellum. So again, animal needs to be euthanized. For human testing, though, several tests are necessary to diagnose rabies before death because it's not considered ethical to euthanize humans to test them, right? Tests are performed on saliva, serum, spinal fluids, skin biopsies of hair follicles, the nape of the neck. Not sure why exactly there. But then why can't we test those things on animals, right? Why do animals need to be euthanized when humans can be tested with these other methods? So I would propose that perhaps this is a fear tactic to, again, push the vaccine agenda, because if you're told, well, if there's a suspicion, if your pet is not vaccinated and it bites somebody and we suspect it might have rabies, it's going to have to be euthanized to be tested. That'd scare a lot of people into getting the vaccine. So how is the animal brain tested? A direct fluorescent antibody test. So what this is basically is that if the animal supposedly has rabies is supposedly a neurologic virus, it's going to be in the brain. It's going to be a rabies antigen. So they treat the brain with these fluorescent antibodies, which is an antibody that is going to theoretically attach to the rabies antigen, but it fluoresces. So it's this bright, pretty green color. So supposedly if the antibody attaches to the rabies antigen, it's going to fluoresce, and that will prove that the animal has rabies. So again, they say because rabies is present in the nervous tissue, not in the blood like other viruses, the ideal tissue to test for the rabies antigen is the brain. So again, they're saying that the only place we can test animals is brain tissue. But we just learned that humans can be tested using saliva, serum, spinal fluid, skin biopsies. So why aren't we doing this stuff on animals? Why the double standard? And again, is this fear of euthanasia swaying more people into getting the rabies vaccines? So again, the labeled antibody, the fluorescent antibody, will bind to the rabies antigen in the brain. The unbound antibody is washed away, and areas where the rabies virus is supposedly present will fluoresce. The other way, one of the other ways it can be identified is electron microscopy, just looking for it. And this is, again, we go back to our pictures from the CDC, these little bullet-shaped things that are supposedly the rabies virus. But again, how do we know that? Is it, proven? So they have these nice little pictures of the rabies virus, what they call the rabies virus. Do we know it is really the rabies virus? And they say it can be examined in detail, and they know all these things, but may or may not be true. Bullet shaped, and that's just the family, the rhabdoviruses, as they're named. But then, if we're to believe that the rabies virus is so easily seen under the microscope, I mean, just think about this for a minute. So rabies, the whole thing is dogs can spread rabies, mad dogs spread rabies through the bite. Salivating, they're, it's a sign of rabies, and that saliva to transmit the rabies virus. The rabies virus has to be in the saliva. So why don't they just look at saliva under the microscope and look for these little bullets? Shouldn't that identify the rabies? Why do we have to do this elaborate brain testing and all of this when they know exactly what it looks like? They know exactly, remember the diagram, how it travels to the body. Why can't they just go look for it? Why do they have to be euthanizing the animals just to even do the test? This is the picture, that traveling through the body, they know the exact pathway. So again, our pets being put to death needlessly to test their brains, as if what they're saying about what they know about what the virus looks like, how it travels through the body, that it has to be in the saliva. Why not just look there? Okay, so are these tests accurate? Do they really tell us anything? So the direct fluorescent antibody test used in the United States for 50 years, there's been no indication that it has failed to provide accurate clinical information on the rabies status of the animal. So no indication that it failed to provide accurate clinical information. Wouldn't you want definitive proof? If animals are being euthanized, no indication that it failed to provide accurate clinical information. That's just so vague that it really tells us nothing about the accuracy of the test. It's putting pet and human lives on the line with no true science whatsoever. But yet, because the CDC says it's highly sensitive and specific in comparison to other virus isolation methods, it's the gold standard for testing. And it's the only recommended diagnostic method for rabies determination in animals. Based on what? The claim that there is no indication that it failed to provide accurate clinical information. I mean, come on, that really tells us that this test pretty much tells us nothing, and that there's no accurate data that it's even accurate. Does that give you any confidence in this test? the test that requires killing pets to perform it, and the test that looks for a virus that may not even exist. Maybe because it's so hard to validate these tests, that's further evidence that there is no virus there in the first place. And we need to be seriously questioning. We question everything. So again, if the pet was capable of spreading the rabies virus at the time of the bite, the virus would be present in the saliva. And this is what we're taught. This is what I was taught as a veterinarian, that the rabies is a neurologic virus. If an animal bites somebody and they have rabies, the rabies virus is going to get on the nerves. It's going to travel up the nerves to the spinal cord, and travel up the spinal cord to the brain, and then it's going to come down the cranial nerves to the salivary glands, and it's going to be spread in the saliva. And that's how it gets transmitted. And I was taught it's like a survival mechanism of the virus, supposedly, to make the dog kind of aggressive so it bites more. This is what we're taught in vet school. So again, everything we've been taught says the saliva should contain the rabies virus. So that should be the conventional mindset. That's what's taught on the conventional side. So why aren't we just testing the saliva? We could collect multiple samples. Is that hard? No, it's not hard at all. It's even accepted in human testing to check the saliva, check the other body fluids. Why aren't we doing that in pets? Okay, vaccine recommendations. Who creates the guidelines for rabies vaccinations in pets? According to the CDC, all dogs, cats, and ferrets should be vaccinated and revaccinated against rabies according to the product label directions. So the companies selling the vaccines get to decide the dosing schedule. Sounds like a pretty good business model, doesn't it? You get the medical industry to require your product over and over and over and over again, and they get to decide what the protocols are. This also infers that there's no independent research outside of the manufacturer to determine vaccine safety, efficacy, and duration of effect. These vaccine companies are not hiring some independent research to prove anything about their vaccines. Any research that comes out about vaccines or vaccine safety is funded by the companies making them. So you know they're not going to want to come out with research results that are going to tell you their vaccine is bad. This is an excerpt from Zoetis, which is the veterinary branch of Pfizer, their rabies vaccine insert. Zoetis believes that the information contained in the safety data sheet is accurate. While it's provided in good faith, it is without warranty of any kind expressed or implied. So they're just kind of saying, can't you just trust us? And we're not going to really guarantee that any of what we're saying is true, but just, just trust us. Believes that the information is accurate. Like, again, shouldn't this be proven safety? Wouldn't you want to know that their safety data is accurate and well tested, because your pet's life could depend on it? And again, it is without warranty of any kind expressed or implied. So, they could say, oh, sorry, just kidding. We thought it was safe, but it's not. But oh, well, they never told you that we'd guarantee you that this stuff was accurate. If data for a hazard are not included in this document, there is no known information at this time. The information on the sheet was written based on the best knowledge and experience currently available. So it means there may be more information that they don't want to tell you. That they might have some secret data, back in their own private research that they're just not letting on to you. Does this instill any confidence in a company's diligence in providing a safe and effective product? It sure doesn't for me. And guess who veterinarians are relying on for their information on vaccine safety? It's coming from the sales reps, comes into the clinic, that buys everybody lunch and says, look at this great new vaccine. We got this data, it's safe. Well, the companies aren't even guaranteeing the safety. They're not even saying that they have good safety studies. So the form further says on germ cell mutagenicity. So this would be leading to things like cancer. Due to partial or complete lack of data, the classification is not possible. No data available to indicate product or any components present at greater than 0.1% are mutagenic or genotoxic. So they don't know, or they're not looking, or they don't want to know. Carcinogenicity, due to partial or complete lack of data, the classification is not possible. Sounds to me they're not looking. Like, they really don't want to know their products can cause cancer. So let's just not look. Let's just say that information isn't available. Because if you did know the truth, might cut into vaccine sales, and we certainly couldn't have that. So is this products that you feel are well tested and that have your pet's best interest at heart? Not by a long shot. And I bet anything, if you ask your veterinarian, are they aware of this? Are they aware that there's no real safety testing? Do they know how safe the vaccines are and the potential side effects? I challenge you to go into your vet and say, let's look at that package insert on that vaccine that you're requiring my pet to walk in the door before medical care. But they haven't even read it.
You know what, Dr. Jasek, I gotta wonder what the vets would say if our pet parents actually asked that question. Don't you think they would say, we've had no reported, side effects from the vaccines. And yet you and I and all of our experts have looked at dog after dog after dog. One of the reasons that we did the Itchy Pet webinar had to do with the toxins going in the body. We see the effects. But if you ask that question, folks, don't expect that they're going to say, well, of course, yes, we absolutely see the dangers and we are in favor of it.
Right, because a lot of the effects don't get recognized because it's the cancers 3 months after the set of vaccines, or the itchy skin that might develop a few months on down the road. The immediate effects aren't like pets immediately break out into hives or have a seizure in the clinic, that sort of thing. But, I think it's still good to, challenge them on this. Ask if they've
Yes.
been tested. Ask what the testing is. Ask what the companies have done, to test their products. Just get them to think a little bit, make them a little uncomfortable. Might make you a little uncomfortable, but make them a little uncomfortable.
Yeah, and and Neely says it aptly. They're going to say, "I'm the doctor. I went to school for years. I know more about this than you do." And I think it would be very funny if our pet parents could take this information that you've presented tonight, research it, and ask some questions that it would clearly flush out whether the Mr. and Mrs. Whitecoat really had all the information that you will have in your hands as a pet parent. I think this is brilliant.
All right, let's get more brilliant. So current veterinary protocols in clinics currently required nearly 100% of clinics, or pets are denied care. And this has just gotten ridiculous. Even established clients, I've talked to people who have elderly pets that have no risk of rabies. They don't go out and about. They're just in the home. Cats in particular, indoor cats, will be denied care when the rabies vaccine expires. Like, hey, rabies shots due next month. You don't get it updated. Sorry, go someplace else. And a pet that has no risk of rabies. It's ridiculous. Okay, so why is this a problem? Well, pets are not receiving physical exam. No history is being taken. The veterinarian knows nothing about the underlying health of that pet prior to giving them the vaccination to determine if they're even healthy enough to handle that. And if there's no risk, what's the point of requiring these vaccines? This even goes against the vaccine manufacturer recommendations, and they're in the business of selling vaccines. But even Zoetis says that this product has been shown to be efficacious in healthy animals. A protective immune response may not be elicited if animals are incubating an infectious disease, or malnourished, parasitized, stressed due to shipment or environmental conditions, or otherwise immunocompromised, or the vaccine is not administered in accordance with label directions. So the vaccine manufacturer themselves are saying, if a pet has any of these things, going on, their vaccine is not going to be effective. Yet the veterinarian is saying, well, I'm putting one of the reasons they give is I'm putting my whole staff at risk if, I don't vaccinate your pet for rabies before it walks in the door and they handle it. Yet if they're not examining the pet and determining if the pet has any of these conditions, well, if it does, the vaccine is going to be ineffective anyway. So they're just vaccinating the pet really for no reason and creating toxicity in the pet. And if the pet does have underlying medical conditions, going to be making it sicker.
And Dr. Jasek, you and I talked about this on the podcast the other day. And the statement that you made was, if a pet is required to get a shot right as they're walking in the door because they don't want the veterinarians to be exposed to rabies if they get bitten, your response was the vaccine doesn't work right away, if it works at all. But I mean, it's not like, okay, in walks the dog or the cat. We don't know them. We're not going to examine them. So let's give them a shot so we as vets can be protected. That doesn't even make any sense. So another question that would be great for our pet parents to ask is, how long does it take for a vaccine to take effect before you're protected if my animal happens to bite you?
Right. Good point. It takes even, you completely buy into the conventional narrative that there's a rabies virus and that these vaccines provide protection. It takes 1 to 2 weeks. You don't build antibodies instantly. It's not like they get this immediate umbrella of protection. So yeah, the whole thing, it doesn't make any sense at all. And I think these are some pretty simple questions like that. How long does it take for my pet to have an immunity to rabies after you give it that shot? And just get them thinking about how absurd some of these recommendations are.
And one other thing, Dr. Jasek, if I may interrupt your fabulous presentation. Wouldn't a vet know if when the pet walked in that it had rabies? Wouldn't there be a sign?
One would think. Now there's, the whole thing about asymptomatic spreaders. We've heard that.
Oh my
before.
gosh. If I hear that one more time.
We've heard that one before too. So they would probably try to play that card. But yes, especially if the rabies could be transmitted in the bite, it has to be in the saliva, which means it has to have already affected the brain, which at the very least, that pet's behavior is going to change and they're going to be aggressive. And it's supposedly a neurologic virus. So there's going to be if the brain is affected with a virus, there's going to be some neurologic symptoms. So in my mind, it would be impossible to have a pet infected with rabies and not be showing symptoms. So maybe they need to take that course in vet school again that taught about how to diagnose rabies.
Yes, ma'am. Okay.
Maybe they need a little refresher course. Okay. And again, veterinarians are going against the professional association and state board recommendations to follow the manufacturer guidelines. It's a violation of standard of care. They're not even following the recommendations of the insert and the product they're giving. They're probably not even reading it. My opinion, again, this should be considered malpractice. And you guys have the right to report veterinarians to the state board. Nothing the vet hates worse than getting a letter from the state board. And every letter that is sent in, they have to respond to, regardless of what it is. The veterinarian is required to respond to any complaint to the board. So just a little FYI there, should you be so inclined. Okay, a different company, Boehringer Ingelheim's rabies vaccine. This is in cats. So in cats, the administration of certain veterinary biologicals may induce the development of injection site fibrosarcomas. This is a very aggressive soft tissue tumor. Seen these, very, very bad deal, shown to occur in cats. So the veterinarian you are trusting to care for your pet is now injecting a potential carcinogen before even evaluating your health status. So your pet's health status. So your pet may not be healthy. You don't you don't know, the vaccine might make them sicker, but they want to do this before they even take a look at your pet. Does that sound like ethical practice? Sure doesn't to me. This particular issue has been primarily reported in cats, but I have certainly seen many dogs suffer adverse effects from the rabies vaccine, including cancer diagnoses a little further on down the road because of disruption in immune system function, and just they're less healthy, they're more inflamed. So it's not as recognized. However, how can something this toxic in cats not be affecting dogs? I mean, it's a known carcinogen in cats. It's not going to be healthy for your dog either. AVMA website. So these tumors, and it's actually recognized on the AVMA website, can develop weeks, months, or even years after a vaccination. So the AVMA recognizes that these vaccines can cause tumors that show up later. In the real world, in veterinary medicine, rarely would that be recognized. The only adverse reactions to vaccines that are typically recognized are the ones where the pet drops and has a seizure on the way out the door of the clinic, breaks out in hives, vomiting and diarrhea, or after they get home. If it's even a couple days after the vaccine, they don't attribute it to the vaccine. However, and I work with a lot of cancer patients. It's one of my specialties, and I see so many cancer patients that get that diagnosis comes within a few months of the last round of vaccines. They just become that tipping point. It's just the last load of toxin, and the body can't handle it anymore, can't process it anymore, especially if the pets have not been on a good diet. And it becomes a tipping point. And I've seen it so often that I just know that these vaccines are a leading cause of cancer, especially the extreme uptick in lymphoma that we're seeing lately. Okay. The AVMA also recommends vaccinating cats in consideration of the cat's specific needs, local epidemiologic factors, and in line with manufacturer directions. So again, the vets are supposed to be reading the package insert, looking at evaluating the true risk to the cat. Vaccination is a medical procedure to be performed only after careful assessment of the needs of the patient, rather than as an automatic act dictated by the calendar. This is from the AVMA, you guys. I mean, they're telling the vets you should be examining your patients and not just looking at the calendar like, oh, they're due for their rabies shot. Not going to see you. Why are the vets just ignoring these guidelines? It's important to tailor vaccine protocols to the individual patient in order to protect your pet's health and public health, while also preventing unnecessary vaccinations and opportunities for injection site sarcoma development. So again, their AVMA is telling the vets, you need to tailor these protocols to the needs of your patient. Well, how are they going to know the needs of the patient if they're not even examining them and taking a history and finding out, what's going on, and maybe doing some blood work and, fully evaluating them and preventing unnecessary, AVMA is saying we should be preventing unnecessary vaccinations. And they say your veterinarian is the best resource for working with you to make these decisions with your cat's age, health status, and lifestyle in mind. Well, it's the best resource. It's not a very great resource, though, based on this, is it? So why aren't vets following these recommendations? Really good question. Again, narratives get started, things get said over and over often enough, and it becomes the truth. Furthermore, that's not enough to get you. The AVMA states, many veterinarians are placing vaccines in sites that would make tumor removal easier should an injection occur. For example, placement low on the leg instead of the interscapular space, or even vaccination on the tail. So vaccines traditionally given here at the back of the neck, right? And these tumors develop, they grow down into the tissue and around the spine, and almost impossible to remove. They're very, very painful. So instead of not giving the vaccines, which are toxic and cause these tumors, well, let's just give them in a place of the body that's easier to amputate. And that's really what that's saying. Instead of stopping a protocol that's causing these effects and causing cancer, causing these aggressive tumors, let's just put in the leg of the tail because we can cut that part off. That's how sick this is. It is just, it's so it's so barbaric. I mean, I can't even believe that the veterinary profession has gotten to this point. And if that doesn't make you question modern medical policies, I don't know what will. Question everything. And of course, follow the money. More from the AVMA recognizes that some animals might benefit from a waiver from mandated rabies vaccination because the vaccination may endanger the animal's life, or a waiver might be necessary for research purposes. If adequate steps can be taken to minimize the chance of exposure to rabies virus, the AVMA supports such animals being granted a waiver from mandatory rabies vaccination upon recommendation of a licensed veterinarian and with concurrence of the appropriate veterinary public health authorities. The AVMA is endorsing medical waivers for animals that have a medical condition. Now, a perfectly healthy animal probably would be hard to get a medical waiver, but it's saying in certain circumstances, veterinarians should be considering this. I've written a lot of rabies waivers, medical waivers in Colorado, because Colorado allows them. And a lot of vets won't even take them, won't even acknowledge them. They say they're invalid. It's not a valid reason. But yet the AVMA, again, is saying that these waivers should be allowed, or a veterinarian should at least be considering them.
And Dr. Jasek, wouldn't you consider a dog that has chronic itching a dog that is not well enough to get a rabies vaccine?
Oh, absolutely. Because it's chronic inflammation, and a vaccine will make any chronic inflammation worse. So yeah, at least get the inflammation calmed down and get them healthy and get them stable before, proposing to do the vaccine. Yeah, absolutely. Any inflammatory condition could be made worse, and healthy pets are made sick with the vaccines too.
Right. So if you didn't need a waiver to begin with, you're gonna need a waiver afterwards.
Yeah,
Okay.
you'll need one for the next round of shots.
Right.
Because of the shot. And they do say waivers should not be issued arbitrarily, should be based on clinical evidence, documented in medical records. The animal be considered a risk of a life-threatening reaction. So yeah, they're saying don't give them out arbitrarily, but most vets won't even consider a waiver. And I think this is just another thing that you can bring up. And, I'd ask you that, or can I hold you responsible if my pet's symptoms get worse after this rabies shot? Are you going to be responsible for helping, get my pet through that, or getting my pet through, any reactions? At least challenge them on it. Get them thinking about it. Yeah. So why are practitioners so hesitant to provide waivers, even if the AVMA endorses them? Well, that would require them examining the pet, actually having a conversation, going over pros and cons of the vaccines before they do that. And they don't want to take the time to do that. They just want to, blanket mandate these things. There would be no more flyby vaccines on the way into the clinic. The vet would actually have to learn something about the vaccines that they were injecting so they could have an intelligent conversation with you about them. They might even have to read the package insert and review it with the pet parents. There's no need for change if enough clinics are using the same protocol. It then becomes standard of care. This goes back to what I said at the beginning. If something is said over and over and over and over again, and it's taught at continuing education meetings, and it's said enough, it just becomes true, and then it becomes standard of care, and everybody's doing the same thing. So there's nobody to challenge the narrative. That's why it's important for you guys to step up and start to challenge. And yeah, I've written waivers for pets with significant illnesses that have been denied by other clinics. Unless the pet is like literally in danger of dying, end stage cancer, or some serious autoimmune condition or something, usually they won't accept the waivers, and they usually won't even write them, even if that's the case. And huge increase in the stringency. Again, after COVID. Vets have always recommended the vaccines, but I've never seen this level of the mandates where their pets, just need the vaccines to just even walk in the door. And I hear this from people all over the country. Pets cannot get care without rabies. And if you think about it too, again, this narrative that's just all over the country, even let's say the rabies virus does exist. Well, wouldn't there be some geographic differences? There'd be, high risk areas, low risk areas. There'd be areas with a lot of rabies, areas with not much rabies, city areas versus urban areas. There should be some sort of difference. Like this blanket recommendation for all vets all over the country and even in other parts of the world. It really doesn't make any sense at all.
Well,
Medically.
come on, Dr. Jasek. You and I heard that here in Colorado that there were 30% of all the squirrels out there and they had rabies, right? It was something absurd like that. But what we wanted to know, how did they get out and do a census of all of the squirrels?
Right?
Right?
How they test them? That's a
How'd
good
they test those
question.
squirrels? Yeah,
Yeah.
we don't really know. So you could just throw a dadgum sphincter number out there, flying out your sphincter, and people just believe it, right?
Yeah. So we got a question.
Yeah, question.
According to the CDC, the United States has been rabies free since 2007. So that's a pretty long time, 15, 16, 17 years. Yet the narrative is getting more stringent. So why is that happening? We're going longer and longer without rabies. I mean, the CDC is saying the United States has been rabies free. It's a 3-letter agency, they're pretty smart. So that should be accurate data, but yet the narrative is getting more stringent and the vaccines have taken on this role of being the vaccine police. So that the current narrative doesn't even match up with that CDC data. Okay, so what reasons do the vets give for doing this? Safety. We've already kind of touched on this. Veterinarians claim they're putting their staff at risk for contracting rabies if patients are not vaccinated. And we've already learned that though it says that the vaccines may not be effective if underlying conditions exist. But if the pet is not examined, we're not going to know if the pet has any underlying conditions that might make this vaccine ineffective. So how's that protecting the team? Really not. By blindly vaccinating without examination, veterinarians are creating a false sense of security for the very people they're claiming to be protecting. And as we said earlier, also, if a vaccination were to provide protection, it's never immediate. So vaccinating on the spot is creating a false sense of security. And all it's really doing is poisoning the pets. And I bet veterinary personnel would be very interested to know that the vaccines they're pushing in the interest of their own safety are not having any benefit at all. What does the AVMA recommend regarding safety of veterinary personnel? Rabies exposure is an occupational hazard for veterinary professionals, and preventative measures are necessary to protect veterinary teams. Pre-exposure vaccination is an important part of this protection, as is a rabies antibody titer when recommended. Now, to be clear, this is vaccinating the humans. The AVMA isn't saying to protect yourselves in the veterinary clinic, you need to be vaccinating all your patients. They're saying the vets and the personnel should be vaccinated. And I think it's also very interesting that they recommend an antibody titer, because this is another thing that most clinics will poo-poo. You say, my pet's had a couple of rabies shots. Can I do an antibody titer? If I can prove it's got a good level of antibodies, then, will that suffice? Well, they won't do it. They'll say that's inaccurate. But the AVMA considers it accurate if you're the vet or you're a tech. At the CE meetings, the continuing education meetings, you go to the big AVMA meeting that they put on every year, they offer rabies titer testing to the vets. It's like a complimentary service there. So it's recognized as valid in people. It's not recognized as valid in the pets. But the AVMA is not saying to the veterinarian, to keep yourself safe, you got to vaccinate your patients. And most clinics, again, will not consider titer testing a pet valid, or they charge astronomical prices. I've had people tell me they were charged $400 or $500 for a rabies titer test, which is just ridiculous. There's no reason it should cost that much. That's just a clinic that doesn't want to be doing it. And if titer testing were accepted in clinics, then many pets would avoid unnecessary and harmful vaccinations. So it's clearly another double standard. And it is debatable, of course, what does that antibody level mean? How much antibody conveys protection? I say, for right now, with the state of things, if we could get antibody testing more accepted in veterinary clinics, maybe even by some cities, counties, and states in lieu of vaccines, if that number on the paper gets a pet out of a vaccine, then I'm all for it. We don't have to debate necessarily whether or not it conveys protection. If that number says that that animal is protected and gets it out of a vaccine, then I say let's do it, and let's push for more of that testing. It's a very simple blood test. Okay, more from the AVMA. And protection doesn't stop here. The PrEP, that's their acronym for the vaccines, doesn't replace good preventative practices, appropriate use of protective equipment when handling animals or lab specimens. So this is, gloves, muzzles, restraint bolts. Let's train a personnel to properly handle pets. If a pet's acting aggressive, we put a muzzle on them. People should know how to handle pets and how to act around pets in such a way that they're comfortable in the vet clinic, so that aggression is not as big of a problem. And this is the actual link. All of this stuff is on the AVMA website if you want to look it up and take any of this information into your own veterinarian. And they do talk about training and if necessary, I've had clients go in and say, look, if you're so worried about my dog, just give him a little tranquilizer. I'm fine with that. I'd rather have him, a bit sedated than get a rabies vaccine. If the whole idea is safety, but the vets don't usually go for that one. Okay. Vaccinating pets. Yeah, if the vaccine was to convey immunity, it may take 1 to 2 weeks. So it makes no sense to give the vaccine on the way in the door. We've already covered that. The other part about this is, so they're saying that they're protecting their staff by vaccinating your pet. Well, if you're on the way in the door to visit at your vet, your pet would already have to be infected with rabies. And as Dee Dee was saying before, should have symptoms. Well, at that point, the vaccine isn't going to do any good anyway. Your pet's already shedding the rabies virus. So again, it makes no sense. It's providing another one of these false sense of security, because the staff is thinking, oh, the dog's had this, rabies vaccine, or the cat, and now unprotected, which if they were at the highest risk, they're at the highest risk of getting rabies if the pet's already infected, and the vaccine isn't going to do any good anyway. So none of it makes any sense. Vaccinating pets to build their own immunity, build the pet's immunity to rabies, does nothing to protect veterinary personnel, bottom line. Causes needless harm in the form of vaccine side effects, just another moneymaker, potentially based on a non-existent virus. So veterinarians are placing the burden of their safety on their patients instead of making it their own responsibility. Ask your vet, hey, have you had your rabies shot? Because if you've had your rabies shot and they're so great, what do you need to vaccinate my pet for? Because should be protected, right? I think it's a very valid question. So should veterinary clinic safety be the responsibility of the client or the clinic personnel? I think as the AVMA stated, it's an occupational hazard. We know that we are at risk of getting bit. So it should be up to the personnel, in my opinion, to provide their own protection. The other commonly cited reason for mandating rabies is legal concerns. So I've heard these sorts of quotes from my clients. It is illegal for a veterinarian to treat a pet without a current rabies vaccine. I could lose my license if I treat your pet without a current rabies vaccination. But the AVMA, as we already learned, said vaccination as a medical procedure to be performed only after careful assessment of the needs of the patient, rather than an automatic act dictated by the calendar. So the AVMA is saying you need to be examining these patients before you're vaccinating. It's not illegal for you to touch a patient without a vaccine. That's just absurd. And they also said it's important to tailor vaccine protocols to the individual patient in order to protect your pet's health and public health, while also preventing unnecessary vaccination and opportunities for injection site sarcoma. So this is a repeat from what we said before. The AVMA is stating veterinarians need to be judicious in who they're giving the vaccines to. So why are the vets not following these recommendations? Why do they just make their own rules when these agencies are, clearly stating that other procedures should be followed? Furthermore, I've yet to read from the Practice Act from any state that supports the claim that veterinarians are only to treat pets with a current rabies vaccination under terms of their license. So in Colorado, where I practiced for many years, the practice code reads, vaccinations can involve some risk to the animal. Therefore, the selection and administration of vaccinations should be specifically tailored to each animal seen, should be undertaken with care by the veterinarian. So again, this should be examining the animal before the vaccines. The animal's lifestyle should also be taken into account, his geographic location within the state, and its particular health problems and corresponding risks should be evaluated. If there's any health concerns, maybe we shouldn't be vaccinating. Veterinarian must also ensure that the vaccinations given comply with state and local laws. So yes, educate clients about state and local laws. The board encourages practitioners to communicate with the pet's owner regarding what selections of vaccinations have been made and why, the risks inherent with these choices, and the potential outcomes of these selections. So this means, according to the Colorado State Practice Code, that your vet should be going over every single vaccine that they want to give your pet. And some of these vaccines are combinations. They have 5 or 6 different vaccines. So according to this, they should be going over the risks, the pros and cons of each one of those. And they also say the use of an informed consent form may document these conversations and serve as a reminder to both parties of what occurred. Wow, informed consent. What a novel concept. Does that ever happen today in the veterinary clinic? I would say if it happens at all, it's extremely rare, because this, again, means sitting down and having a conversation, veterinarians sitting down, having a conversation with their clients, explaining pros and cons of the procedures, not just blindly vaccinating. So that's what licensed veterinarians in Colorado, that's how they're supposed to be practicing. There's nothing in there that says you can't let a pet in your door without a rabies vaccine or you're going to lose your license. It says the opposite, that the vets should be providing informed consent. They should be going over the risks of these vaccines and not just blindly vaccinating. So look up the practice code in your state, see what it says, see if there's actually anything in there that says that veterinarians are obligated under the terms of their license to not let any pet in their clinic unless it has a current rabies shot. And I bet nobody will find it. And present that to your vet. Say, look, it says, right here, I printed out your practice code. I don't see anywhere where it says under the terms of your license, you need to be requiring a rabies shot. Okay, so wrapping this up. Okay, rabies vaccine mandates have devastating effects on our pets, and there's no definitive evidence that rabies or any other virus ever existed. So these mandates essentially are based on nothing. We should be considering toxicity or malnutrition as a cause for the symptoms of rabies and other so-called viruses. Let's open our scope of thinking and look at other reasons why our pets are showing symptoms. The veterinary profession will say this is not valid. This information isn't going to go over well, but we just need to persist and keep putting it out there. And it's because they're all stuck in a false narrative. Again, same things have been said over and over and over again for a very long time. They're the truth, they're the standard of care, and these things don't change easily. Why have veterinarians self-appointed themselves the vaccine police? There's no official recommendation to do so. That's, still a mystery, and we need to start changing their minds about that. It's up to you to present this information at any veterinary clinic that is mandating the rabies vaccine. This is the only way things are going to change. It's not going to change by me talking about it. The only way these things are going to change is if enough people walking into veterinary clinics demand a different type of service. Spoiler alert, your vet isn't going to be happy. This will be uncomfortable, you guys. You're going to have to thicken your skin. And your vets are living in a very comfortable bubble because everybody's saying the same thing. So I've got all my, comrades around me, supporting my narrative, and they don't want to step out of their little boxes. So this isn't going to go over well. You're going to have to thicken your skin. And remember that vets are people just like you. They just happen to have a piece of paper that allows them to practice medicine, and you're paying them. They work for you, and they should be following your wishes, and they should not be bullying you into doing things that you don't feel are appropriate for your pet. They're just using intimidation and bullying, like the bullying on the playground when we were kids. You just need to stand up, have your questions ready. Again, go in at a time when your pet is not sick, so you're not having to present information like this when you're emotional and it's harder to make good decisions. And let the power of the truth inspire and guide you. Know that what you're presenting is the truth, and you have evidence to back that up. Take this information to your city, county, or state officials. Advocate for changes in the rabies ordinances. Yeah, there's laws. People say, well, I have to because it's the law. Well, maybe we could change some of the laws. Laws can be changed, but they're not changed unless, somebody takes some action, or a group of people can take some action. If enough people go in and start to talk to the city council, start to talk to your county commissioners, maybe we can make a difference. Change takes time, so we must begin now. It's up to us, and stop waiting for someone else to step up. And one of my favorite quotes from Margaret Mead: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." It's up to us, guys. Thank you for listening.
You guys, thank you so much. You want to work with Dr. Judy Jasek, I would get over to ahavet.com, ahavet.com. Dr. Jasek is so passionate about healthy pets. And you can hear that every week as we do the Raw Dog Food Truth podcast. She also has a Substack. Is it called Substack, Dr. Jasek, that people can sign up for?
JudyJasekDVM.substack.com.
Yeah. So she sends out information on that as well. I know this is a lot, but I think it is really important that you guys understand what your rights are and how nonsensical the protocols have become. So we need to snap them out of it, as I would say, snap them out of it, help them understand that what they're doing is hurting a pet. If you're taking your pet in and your pet is unwell and they're getting vaccinated, that is against the AVMA. All right. So here is a question, Dr. Jasek, and this is a tough situation. This is from an anonymous attendee tonight, but this particular person was told by their vet that their 15-year-old, barely 6-pound female cat had bitten the technician while it was in the back room while the cat was getting their anal glands expressed. Ow! Ouch. But the cat is not up to date with the rabies vaccine because she had it a very long time ago in New York, and she was sick after she got the rabies vaccine. However, the vet said that they are going to report the incident to animal control, And the animal control is going to show up at this pet parent's door. And this cat is sick with multiple serious conditions and will not survive a quarantine outside the home. And so this pet parent wants to know, can they force her to surrender her cat for a quarantine in
You
regards
know,
to what happened here?
I've never seen anybody be forced to give up their animal in the case of a bite. Usually there's a home quarantine where the pet is just, you agree to not let the pet go outside, you keep it in under your care for 10 days, and then at the end of 10 days the vet or the pet is taken into the vet and examined to see if it has any signs of rabies, and if it doesn't, then they don't take pets and euthanize them. And the only time I ever saw a pet be required to be taken out of the home was a client of mine, this was years ago, that got into a big fight with animal control. So you want to play nice in these situations. You know, get along with animal control. You're kind of going to have to follow the rules at that point. But in my experience, they don't want to do anything harmful to your pet. And, you know, I think if you just say, you know, my pet's comfortable at home, I'll sign anything to say that, you know, I'll keep my pet in, you know, maybe offer to even keep it in some containment within your home, something like that. That's what I've seen almost all cases. Now, they do sometimes require a rabies vaccine after that. If the pet does not show signs of rabies, then they do sometimes require a booster. So that would be another thing. If the pet has, you know, certain illnesses that may be made worse, that would be between you and animal control. You have to,
Yeah,
you know,
but
kind of push that case.
but what you pointed out here tonight, I think this pet parent could point out um all the things that you said tonight. Number one, this cat is ill.
Mhm.
If you have even a documentation that shows that a dog was severely injured or sick after a vaccine, the AVMA used their own words against them, right?
Mhm.
And you know, Mr. Tech, are you responsible? Are you going to be responsible if you kill my cat? If you cause further damage to my cat? Let's wait and see if you're going to foam at the mouth, Vet Tech, which I doubt you are, because aren't you vaccinated?
Right.
Haven't you done a
Right.
titer tech, Mr. Vet Tech? Don't we know right now that you have no exposure? I mean, the list of ludicrousy goes on
And
and on and
and
on.
that's a really good point too. You know, say, well, you know, I might, you know, say, I understand veterinarians and technicians should be vaccinated for rabies if, you know, for their protection. So let's get a titer test on that tech and see if his or her rabies vaccine is current. And if not, you know, maybe they need to go get a booster. Maybe they need to be quarantined for 10 days. Just saying.
Well, I think, and I want to remind everybody about this. Remember 3 years ago when we were all going through, there was a vaccine mandate for us. And we were told all of this stuff, and fear was pumped into us, and we had to do it. We had to do it. Looking back, did we really? Did we really? And I think that's where we are in the pet world. I mean, the narrative is so strong, and that's all it ever was, guys. 3 years ago was a narrative, because as we see today, there's no real scientific study, and there is a lot of information that shows that people have become sick, right? So again, what you pointed out is when people run with a narrative, it's the boogeyman. It is the invisible boogeyman, right? It's these words that are scaring people, and there's no scientific information, and it's ludicrous. Just looking at what you presented, the AVMA, the CDC, the fact that these techs they're in a job where they're going to be bitten, just like groomers, right? Okay, then protect yourself. But we have to do our part. We have to get educated. We have to get our knowledge. We have to get our courage up. And I don't think that courage happens instantly. Courage comes, guys, from practicing something over and over and over and over again. What scares you, you've got to practice. I was saying to Dr. Jasek right before we came on the webinar, we had 300 and something people signed up, and it that's intimidating, right? So you just practice. So next time, Dr. Jasek, when we have 600 people, you'll be like, this is nothing,
That's
right?
right.
This is nothing, because you practice that. And you've got to get out and do that. So you could stop sharing your screen now, so your face will come back on. We'll answer a couple more questions. The other question, Dr. Jasek, is where can I don't even know that this information is going to be accurate, but one of the questions is, where do people look to review the prevalence of rabies in the US? And the question is, how concerned should we be or not be about, because they do this, Dr. Jasek. We hear it all the time. Oh my gosh. Remember when the whole thing came out about the dogs were coughing in this one area, this respiratory illness thing that was going around, and everybody, it didn't matter if it was over in Timbuktu, somebody heard it here in Colorado, and they were running to get the shot to keep the dog from having a respiratory
Right.
illness.
Right. They don't even hear about it anymore. That was just what, 5-6 months ago, something, and big narrative, and now it's gone. So you can go to the AVMA website. They will have, I think that should be available to the public. They do publish rabies data. The CDC will also publish rabies data. But again, we have to question the reporting. How are they getting this data? They're talking about wildlife cases. Are they really testing all of these? How are they determining that the wildlife has rabies? Is it just because somebody says that the skunk wandered into my yard and it was acting weird? I think it might have had rabies. Are they actually being tested? And how are they being tested? Is the testing even accurate? We went through that. Can we really rely on that? So that information is out there, but I do think we have to be careful about interpreting it.
Yeah. Are they really doing necropsies on all the brains out there? They're really opening up all the brains and doing the fluorescent lights or whatever they're doing, right? Like all those squirrels here in Colorado, those little bitty tiny
Right.
brains. They were like opening up those little bitty tiny brains. Look at how they got rabies.
Right.
I want to clear one thing up
So they
really
do.
quick too. Can an animal, Dr. Jasek, just sniff the pee or the saliva of a said infected, rabid animal and get rabies themselves?
Not in the way I was taught. The way I was taught, and this is the conventional, rabies virus exists. It is spread in the saliva, and it has to be transmitted by a bite. So even because I've run into this situation a bunch, somebody's cat brings a bat into the house. Well, now you don't know, maybe that bat could have bitten the cat, but if that cat just found the bat and killed it, or found a dead bat and was carrying it around, even if that bat had rabies, the cat's not going to get it, because it has to have been bitten by the bat, because it's spread in the saliva. So there is no casual exposure or casual contagion of the rabies.
Right. Okay, anonymous attendee had another question. In 25 years, where no rabies cases were reported from that shelter in Pennsylvania, and also I've sent you guys some links in here to Dr. Cowan, where he's also talking about this. This attendee wanted to know, were those employees at the shelter vaccinated for rabies? I can't imagine. Now, I don't know. I don't have the report, but are you guys going to go work at a shelter and volunteer to be vaccinated, get a rabies shot because you're working at a shelter? How many of you folks, work in shelters today? Maybe you work in, cleaning the cages or whatever you do there. I would say, no, you can blow that one out your sphincter. I'm not getting a rabies shot. And I can't imagine that volunteers would get a rabies shot. But I do think that Dr. Cowan had talked about something very similar to this, whether it's this case or not, about how many hundreds of dogs had come in and out of the shelter and how many bites that they had, and nobody ever got rabies. So I'm going to say no on that. What do you say?
Yeah, I think it's highly unlikely. I would agree. It's not, the counties or whoever is running the shelters probably usually tight on funds, so they're not going to pay for the vaccines. It's another thing, who's going to buy them? And I doubt that people that are in there, there's a lot of volunteers volunteering at shelters. I doubt very much that they're rolling up their sleeves for the vaccine. I've never heard of it. I mean, I've known lots and lots of people that volunteered at shelters and worked at shelters. I've never heard any of them say that that they got a rabies vaccine or is even talked about.
Yeah. And Paulina Frederick was just saying that she recently visited the prior clinic that she worked at before she left. And good for you, Pauline. And they have all posted that all pets must have all vaccines up to date in order to be seen. So, I would absolutely ask these questions. Do it in a chronological order, right? Are you following the AVMA? Have those questions ready. And I would probably go in and say, who can I talk to about this? Who's running the show here? Now, a lot of these shows are being run by corporate clinics, Dr. Jasek. So we don't necessarily have a solution for if you want to have your pet looked at and they require a rabies vaccine, you got to go. I mean, for
Yeah.
me, I'd be seeking out somebody else.
Yeah,
And
avoid the corporates, because that's tougher, because there's like big corporations making policies and employees are, obligated to follow them or they'll lose their jobs. But go to the privately owned clinics. They're getting a little harder to find, but they still exist. The smaller clinic where you could actually talk to the owner or talk to the practice manager who's making the vaccine policies and present some of this information.
yeah. And Dr. Jasek, I think that some people want this solution that we don't have, guys. I mean, we all have dogs ourselves, right? And as Dr. Jasek has pointed out on the podcast many times, you need to find an emergency clinic, right? An emergency clinic that if your dog gets hit, they get in a fight, they break a leg, whatever, you need to find an emergency clinic and they're going to ask you, are you up to date on rabies? What do you feed? So I had my German Shepherd cut her leg, right? I haven't fed kibble in almost 25 years and I don't put toxins in my dog's body. I go in, they say, your dog updated on vaccines? Absolutely. What do you feed? This kibble, I can't remember the name of it right now. Great. Thank you.
No further questions.
No further questions. Case closed. Your dog's great. Sewed her leg up and gave her right back to me. That's what you want. You want in and out. And our job is to protect our pets. Yeah. And at the same time, challenge the narrative. Don't be so afraid. It's okay. And the other question that people ask, Dr. Jasek, is how do I take care of my pet if I don't have a vet?
Well, yeah, that's a problem. That's why we have to start pushing back. That's why we have to start changing some of these ridiculous mandates. And, like Dee Dee was just saying, favor the emergency clinics. I mean, I used to advocate for going in for wellness checks every year, and I don't anymore because of this kind of stuff. The pets come out of the clinic, sicker or, more vaccines or heartworm shots or pharmaceuticals, and it doesn't seem to be in the best interest of the pet to go in for wellness checks. But should your pet get sick or seriously injured, emergency clinics are not as plugged into the wellness like Dee Dee described. They ask, say, yeah, they're current. They're not likely to take the time to, well, you got to show records and all this stuff. And usually you can say, oh, well, I got another vet I deal with on the vaccines. Can we just take care of my pet now? And then I'll follow up with my regular vet, that sort of thing. So you could probably get around this easier at a lot of emergency clinics. There might be some requiring rabies, but I think it's less common that you have to have it to just walk in the door.
Right, right. So you want to be prepared, all right? And also I do think that you want to have someone on your team like Dr. Jasek who can work with you via Zoom, right?
Mhm.
And the question always comes up, what if my pet has cancer? Okay. Well, if your pet has cancer, you can work with somebody like Dr. Jasek. But you guys, you got to if you're doing everything you can to keep your pet healthy, that means they're eating an evolutionary, species appropriate raw diet. You're doing variety, okay? You're giving raw meaty bones. You're throwing in some veggies. You're doing all the good stuff. You're keeping the toxins out of their body. You're making sure they have good filtered water, right? What else are you going to do? Well,
I mean, health is really quite simple. Like feed them species appropriate raw diet and stop poisoning their bodies. And maybe, it just means you don't do things where rabies are going to be required. So again, maybe you don't go in for wellness exams. You know your pet, if your pet's sick or not, have an emergency clinic if there's a true emergency. I have clients that don't go on vacation where they can't take their pets with now because they don't want to board them. I've heard I've had some people tell me even in-home pet sitters now, some of them are requiring proof of rabies vaccines.
and I
before they have pet
guarantee
sitters.
you, if you ask them why, if you ask these in-home pet sitters the questions that you've answered tonight, they don't even know why they're saying that.
I don't even know.
They don't even know why they're saying that. So again, it's up to you guys. I have posted these links in the chat there on some of these resources or other people that have also looked into the actual science, the actual methods of which this information is being so-called substantiated on. So that is in there as well.
So I'm not the only crazy person saying it.
No. I'm right there with you in the nut house, and I enjoy it. I
It's
enjoy it
fun.
there with you.
It's fun in the nut house.
It is. It is very fun. So, but I want to keep my dog around as long as possible. I want her to be happy and healthy. I don't want her to suffer because I was too much of a wuss to push back. And I'm sorry, I'm going to say that, but I'm never going to be that pet parent. I'm going to fight for my dog. And I'm not saying that, that you guys are wussies or anybody's a wuss. Well, you might be. You might be. I don't know. I'm just.
It's not easy. It's not easy to be confrontational. It makes us all a little bit uncomfortable, but it's the way out. It is the only thing that's going to make a difference is push back in the clinic, because this isn't going to change on its own. And nobody's going to go in and wave a magic wand over the veterinary profession and just say, okay, all these mandates can go away now. It isn't going to happen. It is not going to change unless you guys start going in with some of this information and spread this information. You'll be getting an audio recording, send it to everybody. The more widespread this becomes, we can change the narrative. I truly believe that's possible, but it's going to take time and it's going to take some numbers, because one or two people going into a clinic pushing back, the vet's just going to say those are crazy people. Let's just fire them and let them go someplace else. 30% of their clientele starts coming in demanding a different type of service, they'll take notice.
And I will say we have a lot of customers who tell me I work with a traditional vet, but they don't even go there because that pet parent has a strong personality and they're like, I like you. I want to work with you. Don't talk to me about nutrition and don't talk to me about, vaccines. And some of these vets are like, they don't want confrontation either. So they're like, okay.
Yeah.
And they're able to work with them.
Yeah. I will say that too. The clients I have that say that they have a veterinarian that will work with them on the vaccines have strong personalities. They have sat down with them before they need them, before their pet's sick, had this conversation. This is how I roll. Are you willing to take care of me and my pet? Not, I'll go someplace else. And they're like, they'll say, yeah, I got the little special star on my client, on my chart, you know, like she's one of those crazy people, but they'll take care of my pet and they don't request. So who cares what they think about you? The might, you know, probably talk about you in the break room. Whatever. That crazy person comes in feeding that raw food, but who cares if they're taking care of your pet? That's what's important.
Right. Okay, everybody, we will have the audio version, okay, up in a day or so. And I have all of your emails. I will let you know where that is so you can download it. Somebody asked me if we're going to have the video portion of this. We're going to try. Long videos are hard to get up on the website and let you download. We may I'll talk to Dr. Jasek about where we could post that, whether we want to do it on a Rumble or something like that. Dr. Jasek, we could do that as well.
Or maybe
But
get some of the slides out to people though, so they'd have some of the
yeah,
information. So we could,
yeah,
we'll figure out something.
yeah, we will make sure you have it. Also, guys, somebody said those links aren't working that I sent you on Odyssey for Dr. Sam Bailey. Okay. If not, I will email you all of those sources too, of just Dr. Sam Bailey, Andrew Kaufman, Tom Cowan, in regards to their research into the rabies and the virus as well. Let us know what other things you guys want to learn about. I thank you so much for those of you that make the donation over at Dr. Jasek's page. She spends a lot of time and she did not want to charge for this at all because she wants this information to get out there so that we can have healthier pets, so we can stop doing itchy pet webinars. I don't see any light at the end of the tunnel right now on itchy pets, and I know a lot of you have itchy pets out there, and we can kind of see where that's coming from. But anyway, let us know what you would like to hear about, and we'll do it. Right, Dr.
We'll
JC?
do it. Absolutely. We're here
Okay,
for you guys.
yeah. Remember to get over to ahavet.com. That is where you can find Dr. Jasek's work. If you're not on a species appropriate diet, you got to get your dog on that today. And you can do that right here at rawdogfoodandco.com. Also, listen to the podcast. Tell your friends about it. It's called The Raw Dog Food Truth, where your pet's health is our business and we're friends. Don't let friends feed kibble. Right, Dr. Jasek?
Right. Y'all. Trying to get my y'all in.
That's right. From
Live in
Tennessee.
From
Tennessee
now. All right.
All right, everybody. Thanks so much for joining us tonight. You guys have a great week. We love you. We thank you for being here, and we'll see you soon.
Thanks for coming.
Now I got to find my end button. There it is. Bye.
Bye.